As Davina McCall recovers in hospital, she's doing well, thank goodness. We're talking about body scans because Davina discovered her benign brain tumour because she had a body scan, and it's got people asking whether or not this is something that we should all be doing. Well, Dr Hilary and Dr Amir join me now. So, Hilary, Davina had a scan. It was part of something that she sort of got for doing some work.
Yeah, she was giving a talk for a menopause group, and as part payment, I suppose, she was offered a scan, probably an MRI or a CT scan of the whole body, and she said, "Yeah, yes, I'll fly through that. That'll be no problem at all." And they found this incidental situation where she had a colloid cyst, which is a fluid-filled jelly-like cyst in the ventricle of her brain, which caused her no symptoms and was a complete surprise to her, but could cause problems in the future. So then she had a dilemma. Does she leave it alone? Does she have it operated on? And, of course, if you've got something in the brain which could deteriorate, then
just want it out.
You want to get it sorted out. So quite invasive surgery involved, and thankfully she's better and making a good recovery. Good. But it raises the question, these scans, they will find incidental things that people had no knowledge of without symptoms. Is that a good thing or a bad thing?
Well, Amir, they're getting much more popular, aren't they? I mean, they're not... You know, if you do it privately, it's costly, but they are getting... You know, people want to know.
They do, morning. Yes, so these direct-to-consumer scans essentially are becoming more popular, and it's because people may be worried at home, they may be struggling to see their GP or a specialist, and when they do go and see them, they may not feel like they've been heard, so they feel like they have to get one of these all-over body scans just to make sure. They are expensive in the UK, they can cost thousands of pounds, so people are going abroad to have them done cheaper, and then they're posting about them on social media, and that drives that demand even more. And I have patients coming to see me asking for an all-over body scan just in case. They're not available on the NHS. You know, when they come and see me, I take a focused history. I do targeted investigations if they're needed. But they are a double-edged sword. Yes, they may pick up a disease in its early stages when you've got no symptoms. But the risk is, of course, that they pick up these incidental findings. Lots of us will have nodules, cysts or growths that are completely benign, harmless, inside of our body, and then there's the anxiety knowing you've got something there that may make you think you've got symptoms that aren't really there, and then it's a question of what you do about it. Do you have invasive surgery that you might not need or not? So it's definitely a double-edged sword.
No, it really is. You're right. Or it gives you that sense of security that nothing's wrong, and you can maybe ignore other symptoms. You know, our Ross had one in Los Angeles. He went along and had a scan earlier on this year.
We're going to do a preventative scan of your entire body, so screen you head to toe. It's going to take about 45 minutes, and we're going to screen for over 500 conditions, so it's going to be an extremely comprehensive baseline of your health.
Cindy Crawford, she's part of the company too?
Cindy Crawford is one of our early investors, yes.
Because she's very much into health, isn't she?
She's extremely health-focused, and she's as beautiful on the inside as she's on the outside.
Thank you so much. Bye. Wow. It's the most relaxing 45 minutes I've had in a long time. Quite weird.
So that's in the States, and that's about £2,000.
Look, these are being pushed commercially quite ruthlessly at the moment. It won't find a blood cancer. It won't find early cancers that are too small for even the machine to pick up. So, you know, it can reassure people falsely, and it will find things that people didn't know of. I mean, for example, it'll find people who've got one kidney or a horseshoe kidney who never knew.
Can you go through your whole life with just one kidney and you didn't know?
Absolutely, you can.
Oh, wow.
I know a patient who had his heart on the wrong side, a condition called dextrocardia. Massively rare, but he had no idea until he had a scan done. So it will find these incidental things. We've mentioned vomit before. Victims of medical imaging technology. So we find these things, and then we've got a dilemma. Are we going to treat it? It's not causing any symptoms.
And I wonder, Amir, you know, if you go for a private scan and it shows something, how does that work with... Because obviously you would want to go to your NHS doctor. Do they talk to each other, if you know what I mean?
Yeah, it's a really tricky situation. So essentially, it's the responsibility of the clinician who agreed to do the scan to action any results. And it shouldn't just be a case of passing it to your GP to sort out. They should then, if there's anything worrying, send you down the right NHS pathway and refer you directly to the specialist.
Right.
The grey area is these benign incidental findings that don't actually cause any symptoms. And lots of people then want to go on the NHS to have something done about them. And it's really difficult to justify doing something about something that isn't causing any symptoms, that isn't causing any harm, when we've got really sick people waiting to be seen. And that's where the conflict arises. And I've had lots of patients present me with images of scans and letters from private organisations saying, well, they said there's nothing to worry about, but I want you to do something about it. And it's a really hard conversation to have.
It really is, Hilary. Is there anything that we can do, you know, to check ourselves, make sure that we're all right, without having to pay a fortune for one of these scans, and without,
Absolutely.
you know, without having to add to the burden on the NHS?
Yeah. For most people, the NHS health check is a very reasonable thing to do every 5 years, between the age of 40 and 74. You'll be invited for one of these health checks, and they look at conditions such as heart disease, kidney disease, the risk of having stroke. So they measure your blood pressure, your height and weight. They'll do a urinalysis to look at any abnormal constituents in your urine. So it's a basic check. It won't do anything like a scan does, but it'll be a basic check on all the common things that could occur to people of that kind of age group.
Right.
So that's well worth having.
Yeah,
it's inexpensive and it's available free on the NHS.
Which is a great thing. We're so lucky with that.
It's preventative rather than treatment.
Exactly. And I mean, we know sometimes, you know, like I've said, the NHS is burdened, and we don't want to add to that. Is there anything else that you can do if you can't get access to this NHS check?
Yeah, there is. So Boots are offering a free health check MOT to people over 40 if they haven't got any underlying conditions. That's a kind of a weight, your blood pressure, a basic health check. There's something called York test. They charge £55 for an at-home finger prick blood test that looks at cholesterol and blood sugar. John Lewis and Radox are offering a much more extensive, more expensive private test, anything between £300 and £4,000, depending on the detail of what you want to know. But my advice, Lorraine, is if you've got symptoms, go and get them checked out by your doctor. But if you're feeling well with no symptoms, the only thing I would recommend is buying a blood pressure machine from the chemist. Check your blood pressure regularly. If it's persistently high, go and see a doctor. And if you are well with no symptoms, the best things to do to remain healthy, I say this all the time, move, eat good, nutritious food, sleep, manage stress, get out in nature. That's better than any scam.
Yeah, you're absolutely right. Thank you both so much. Thank you very much for that. And it's always that thing, you know, we say with change and check, know you're normal. You know, if you're checking your boobs or if you're checking yourself, know what's normal for you. Thank you both so much.
Looking for more health and wellness content? Well, there's plenty more really useful information right here on our channel. How about you check out this one?